Okay, wonderful. All right, this is pretty fancy. I just have to say, I don't know. Okay, I'm gonna say got it. Usually I'm the one watching on the other end, or we're all becoming more and more technically savvy, right? Whether we like it or not. So I'm Dr. Tanya Collett. I've been in this field for about 20 years. And the reason I got into it was because, see if I can advance my slide. Not moving.
Well, there she is, big, but
There's a punching
Like
bag.
it doesn't move, or
she's,
All right, guys,
that's
my
where she's
slide
giving a
isn't moving.
lecture, I guess.
I'd like you to see my slides that I made, if possible.
Oh, good.
Oh, there we go. Okay, great. All right.
But how
So,
can we?
I've been in this
Here.
field for about 20 years. I've seen quite a few patients, a lot of
Here
different
you-
areas. I got into the field because I had visual issues myself. I had trouble with words moving on a page, things going blurry and clear. And then I
Let's see.
realized through my life
Heard
that there
video.
wasn't a lot of people that had understood what I had gone through and wanted to be able to share those experiences and help others get out of those spaces and find new ways for treatment modalities. I've worked under some amazing people that I feel blessed about in a lot of different venues. William Padula, I've also worked with sports teams. I've worked with rehabilitation centers, developing protocols for risk to fall and cognitive memory and things of that sort, realizing how much that the visual component can play so into how we process information, how we work through space, how we be able to read and integrate all of those pieces. So many times we tend not to plug in the space of vision. And so that's why I got more and more involved in what it is that we do. I now fortunately am a part of the International Executive Board for what we call NORA, which is Neuro-Optometric Rehabilitation Association, where I've one of 3 of the executive directors on that board. And excitingly, in about a month, we're flying to Poland to train and teach doctors there of how to be able to observe and teach. So it's very exciting, and I'm a little nervous, have to admit, but we're all learning together. So, as we look in the world of Parkinson's and we start seeing, okay, what are some of these symptoms and how would vision even play into that? I dive into some of these pieces and think, oh, that's not vision. That has to do with my body. Oh, no, that's not vision. So as we work through some of these areas and we think, okay, any type of trying to figure out how to move your body in space, how to organize that space, and even how we read and process has a lot to do with vision. So let's look at this a minute. Get your eyes checked, go to an eye exam. They look at your acuity at distance and up close and say, hey, all right, well, you're pretty good. Things are going pretty well. Nothing in back of the eye that's really alluring. And we're good. You're fine. Here's your glasses. Have a great day. And then you put them on. You're like, wait, I'm still having trouble with understanding my space. I'm still having trouble with knowing how to look at things, so, and that's where we go into, there's a difference. There's a difference between a general exam or an ophthalmological exam and a neuro-optometric rehabilitation assessment. And so the way I try to explain that in terms, both are very important. I don't want to say one versus the other, but I want us to be able to see that when we look at a neural vision evaluation, we're looking more in a dynamic function. We're watching how your eyes tend to move in a full area of gaze, how well your eyes actually have that ability to create what they call convergence or divergence, being able to use this area field. If you could think of my eye as being a camera or say a flashlight, and you got this whole field covering the area and this whole field covering the area. And what happens is if you have an area of regard that you want to focus in, your eyes have to come in and converge And those fields have to kind of shimmer into each other and connect to be able to understand depth. And to understand depth is also your ability and your perception of how you understand space. To understand space, let your proprioceptive system or your body information be able to know where to put your foot next. How to be able to grab your glass of water. How to be able to move to the next room. So it deals a lot with how you shift in your body, to even how you think about when you're trying to read information. So it's important to have that refraction. It's important to have those glasses. But there are other pieces of that which we dive into. I have quite a few different manuals, and we break those up. We had a large grand opening, and we went specifically into what is a neuro-optometric evaluation. What are a lot of the pre-tests that we do? Because we do over 45 minutes of testing, and then you're with me for 45 minutes to determine what type of functional prescription do you need. Because our goal, in my viewpoint, is function. Sight is important, but we want to be able to integrate our eye, our brain, and our body together to understand that space and work as optimally as we can. So when we look at this and we think, okay, we're looking at refraction, and I'm also looking at pathology, but we're also evaluating on this ocular motor testing. Ocular is eye, motor is movement, and the ability to see how well do your eyes move, right, left, up, down. Is there any type of stagnant movement that's going on? Where is it? You have more trouble when you're looking down, when you're looking up, left, right. And this is some of the piece that this collaborative effort that I so love in a multi-approach to be able to say, okay, when you're doing those techniques, make sure that his head is up a little bit, his chin is looking up a little bit, so then he's in a lower area of gaze. So you're getting the feel that he works more optimally in, okay? Or we'll work on those areas, or we'll adapt for a short time, but then we'll also work on those skills, so maybe we can improve that as well. So those are pieces that we look at as how to mend the different specialties together to keep training the brain to take on the information. Because as I see it, when we look at our overall processing of information, a lot of times it's taking an unconscious behavior and making it conscious. And that's why I love what I do, is because I believe in neuroplasticity. And we see it all day. Yes, most definitely. And that's what we work with. And so I kind of back up a little bit. I started my practice in a sense of working with children. I worked with children that had learning related difficulties. That was my space. We found that 3/4 of children with learning disabilities had visual issues. Well, as we dove in a little bit more, they started looking like mild traumatic brain injury. Like, that's interesting. So then I started working more with motor vehicle accidents, stroke patients, and other type of neurological insults. Then we started realizing all these different correlations of what was going on. And so it started blending into the different areas and how so many of them are related to each other. And so as I started working in that, then it opened up into, would you work with my athletes that have had a concussion, or retired because they had such a strong concussion that we were trying to get them dysfunctional, okay? And so as that led into, I had a patient that came in, and he said, I was wondering, how do you work ever with more of the older population and risk to fall? And so as we had this conversation, there was a whole connection to watermark property. And so that's where during this whole 2020 world, which we all, I'm sure, have our moments of where we were at that moment, I then moved my practice into working in Hacienda at the Canyon at one of the locations at Watermark. Why? Because we are finding, why I love, is that we have neuroplasticity all the way through our life. And so that's what we're developing now is other type of modalities to help out with wrist to fall, with overall movement, enhancing process and development in memory care. So all of those areas deal with vision. And so we work with all the way from children with learning disabilities to athletes that are having difficulty, to adults that are having memory loss, to others that are having wrist to fall. So it all tends to play in the same space. Why? Because when we think about vision, vision is not just about our eyeballs and bringing in a frame to be able to make sure that light hits the back of the eye. What we learn about is that vision is really a part of the brain. And so you have the brain and you look at the development. The eyes are a direct extension of the brain. So as we train the visual system, we're directly training the brain to process and integrate. And so as we look at that, we're learning of where are the strengths, where are the weaknesses, and what are the goals of each person in their journey of what they're interested in. And then we start looking at that and saying, okay, what is it that you can do? What are you having struggles in? And let's see what we can develop to give you the best opportunity for success. So as we look at this, and I want to make sure I'm more interested in you just seeing that when we look at what's going on in Parkinson's, is realizing that we're dealing with a brain processing system, right? They're trying to figure out what's going on with that. So does the visual system involved with that? Most definitely. We're finding that some of those retina fiber layers are becoming a little bit more thin. But we also know that we can build different levels and different neural pathways to be able to ignite those and integrate those in another way. Why? Because they're connected. They're directly connected. There's more different areas in the brain for vision than any other sensory modality combined. It's a big statement. And so when we start looking at, okay, what is going on with this? I work with macular degeneration, and there are some limitations of what we have. But we also say, okay, what is it that I do have? What are areas that I can work with and what else can I do? So that's what we look at is what's happening with that system. So when I look at the visual system, if we go back to those spaces and say, okay, I got this visual field and I have this visual field. And what I find is one of the things we find is with Parkinson's is there's this disruption of how to use your eyes as a team. Okay, so you may see really well with each eye, but when you start integrating and start moving through space and trying to understand that interpretation of space and how to work within it, then it gets a little bit more confusing. Because now you have to work in a binocular situation, not monocular, not with one eye. It is important to have good eyesight, but it's very important to understand how that sight system works together. And if we don't test it together, we don't really know how functional it is. And so there are these symptoms that we talk about. In the first picture, you have a clear dog running through the pasture, right? So you have that system of it being very clear, but you still can see the dog, but you can see that you can have what they call horizontal diplopia, where the eyes can actually just tend to go out just a little bit, just enough that they may not be fully teaming together to merge those two systems to glue together to hold and keep stability. Okay, the other option is you can have a vertical situation where the eyes tend to come up a little bit, or one eye goes down a little bit, but there's a disparity in the vertical meridian. And some of those either you can look at the body posturing, which we can go into a little bit later, is how much can this be playing into it? And if we know this information, okay, now I got something else on my head that I know that I'm having trouble with. Now what do I do? My goal is success, okay? We look at these things, we figure out where you are, and then we decide what else we need to do. So if you find that there's a tendency when you watch either your partner or your significant other or even yourself, and in a picture, if you have a tendency to tilt your head a little bit when you're looking at something, you're watching a movie and you get really into the movie and your head keeps tilting, you might have a little bit of vertical disparity. So when you get your eyes examined and you cover one eye and you cover the other eye to look for sight, maybe a very good prescription for sight, but how is it when you're trying to function? How is it when you're trying to move? That's the part that gets lost when we look at our daily life and our activities that we're doing. If you require this, and you can have the best therapist out there to help you, and you're teaching movement in space, it's going to be a lot harder to make that midline shift, right? That shift over to that other foot if you're like this versus like this. And just imagine if you take that same situation and you do it. You mimic your partner, your significant other, your family member, you. And how it feels different if you back yourself up against a wall to make sure you're safe and saying, okay, I see the world this way. How does my body posture work with that? My proprioceptive system take in that information versus when I tilt my head. What happens just by tilting my head? What all changes in that communication? What if I turn my head? Let's not even tilt it. Let's just turn. What world, if I look through this eye and I look through this eye, how is it different? How do I move my eyes differently in an ocular motility movement? Or how do I walk in space? Forward, backward, side, side, ask me to turn around the other way. It's a totally different representation of space. And once you experience that, you have the understanding of what really is going on. So what do we do about it? There's a lot. Let's dig a little deeper. This is one of the pieces that I had trouble with in reading. I was diagnosed from A to Z. You got this. Oh, now you have this. Now you got this. Oh, now you're not going to graduate from high school because you got this too. Okay, fortunately, I had a mother that didn't give up. So I'm still around and I'm here. So, and that was some of that. And I guess maybe that's why I'm so driven to be able to explain this level of expertise and to keep talking about it, is because there are spaces for improvement. If you're trying to read something and your eyes are not teaming, what's going to happen is it's going to change your perception or your picture about what goes in for information. You can have the most intelligent person in the room, but if they're trying to get the words and the words are all moving around, I'm sorry, they're going to have trouble, right? So you have to learn of how to be able to create that information in an appropriate way. One of the tests that we run is called a right eye. I wish they would change the test because it's like, oh, you're only testing the right eye? No. No, it's more right versus wrong. And this is the right eye compared to the left eye. So here it is. When you look at this, there's one space. You can see this is more the norm function of how you use your eyes. You look at how the first section is called a pursuit. A pursuit is a smooth motion. That's some of that ocular motor testing that I was talking about before. You have to take your pen, you follow around, and you see how their eye teaming, how well their eyes move. Okay, you want them to be able to follow. And so what we do is we have a computer. They sit in front of a computer, and there's an infrared sensory device that monitors how their eyes are looking. And so they follow that target, and we can say, okay, do they have full range of motion? Can they make a smooth motion as they go into circular gaze? How do they move when they move from side to side horizontally? Why is that important? That's reading, that's scanning, that's deciding where you're going to go next, what the room looks like, right? There's a lot of reasons for that. Vertically, up and down, you look down, you look back up, you look down, you look back up, right? So you're putting all of those modalities together to say, in a constant motion, what happens? Then a saccade or saccade is basically a skip. So I think saccade, saccade, SS, that's how they go together. That's how I remember it. Little tidbit for you. So these are the little like pods, right? You got to take one target, you take another target, and you're saying, okay, if I see this target here, how well can I move my eyes to that target? How well can I move my eyes to this target? Okay, now how do I move up and down? Okay, so you test those areas to see, can I even do that? Because when you think about reading, it requires both. It requires a smooth motion, and it also requires a jump. Okay, so you got to get both those in the space. We try to break those down as much as possible. And we also try to be able to see what happens when we make that movement. The last one is, I'm not going to go, the other one deals with cognitive movement. We have a go, no go assessment to see how you respond. And that's that bottom area there. If you go to fixation, fixation is just your ability. You look at a target. How well can you look at that target and it not move? All right. So you can see here that there's a lot of patients that we have that could start with this ability of having trouble, of being able to follow that target and being able to move. And we see this gives me more of what I call a visual story. I get a better idea about how somebody moves in space, what happens with their visual system, even if they have good eyesight. So I'm looking at dynamic assessment versus a static environment. What really goes on? And this is a way that we look at that. And what we found is that by doing this, then as we worked with them, they got better. As we figured out a functional pair of lenses that can be effective for them and worked with them on learning how to use their eyes to team better with their body movement, that they could learn how to use that system. And you can see here on some of these tests, you can't go too far across the line, but in here on this bottom part, you can realize how much movement that's going on as they're looking down. That's of them trying to read. So anyway, there's parts of it that we look at. Another kind of assessment that we do is called a functional field. You may have done a Humphrey or something like that. You stare and you have to push the dot when you see a squiggle line. Well, this is a little bit different than that. We do that assessment as well, but this deals functionally of what happens. As something is coming in at you, how well do you actually perceive that space? Do you see it? Does it move around? You know, so we do that type of assessment too, and we can find that when we're looking, we want that visual field, that visual window as wide as we possibly can, because the wider the field, the more information you can take in, right? And if you've ever been stressed, it's like you're trying to find something and you look and you look and you look and you're so, oh, I just can't find it, I just don't know where it is. And then finally you relax and it's right in front of you, right? I've never done that before. Anyway, so that's kind of what we're sort of talking about. The more stressed you get, the more that visual window keeps closing down. How do I get this? How do I get this? What am I going to do? And just imagine the more stressed out you get. And then I'm saying, okay, now I want you to relax and I want you to work. Step on that foot. Now step on the other foot. But if your visual window is so closed in, just imagine your world of how you're going to move in that space. We've got to open that space up a little bit more. So what does that do? It gives your brain more information. It allows that visual field to give more information for you to be able to converge your eyes together to work better as a team. So it's like reading a book. If you read 2 pages in the book, it's hard to get to the conclusions, right? So the more information you get, the more you can be able to get that information to take it to the next level of where else you're going to go. All right. So why would somebody in vision be looking at the body, right? Why would I be doing this? Well, because I find that the visual system is kind of like the chief conductor. Am I very biased? Yes, I am. I'll say it straight out. But, you know, as we look at that, I can watch body posture and I can see dominance in visual system. I can see where maybe there could be some binocular disruption of how you're using your eyes, right? How we talked about horizontally, maybe things kind of move a little bit. You put your glasses on, you're like, you know what? This looks really good. But what I find is that it kind of goes blurry and then clear, or I find that it kind of moves around a little bit, or when I start moving in space, then it doesn't stay clear, right? So those are all of those pieces. And the more that I do my work, the more I find how much the body and the vision play together. And so a lot of times what I always bring forward is when we have the most functional unit, is when we can feel the same as how we see, or how we see is the same as how we feel. So I feel like my body is straight up and down, and I can see this world as being easy and clear and functional to work in. If I'm like this and I'm saying, okay, this is the clearest that I can see the world, and the body's saying, no, man, you are leaning to one side, your head's tilted, what are you doing? Get, straighten up. But the visual system will compromise the body in order to give it the best binocular function. And so what we do is I look and use different levels of yoked prisms to be able to see how much is the visual system playing into the compromise in the body state. Is it everything? No. Is it helpful to be able to create a little bit more balance in that system? A lot of times it is, even if there is, a knee that has had injury or a back problem. I always say, would take all that into consideration. Let me just see how well I can balance that system. And so these are the type of glasses that we look at. And sometimes we may find that just by grounding that system in, by working with those yoked prisms, that we can be able to ground that system enough, create that midline organization, so then everything can work better together. Because if the way I feel is the way that I see, then the whole system stops arguing. And then I get the opportunity for freedom of movement with my ocular motility, my eye movement. My binocular system can be able to move easier and become emerging and going back out again. And now I have a more functional unit as a whole. So I hope this is making sense. Is everybody kind of getting the jive of what I'm teaching so far? Are we good? Head? No, yes. Okay. All right. Thank you. Just nod your head anyway, if you can. All right. We'll work this together. All right. So the other piece that we look at is that sometimes we have these little eye twitches that can come in. And the part that I can help out in that space is we can find that if you're not having a full blink, what that can create is also that the cornea, or the front part of the eye, can get dry, right? And also the other piece that we want to be aware of is that if you kind of flip the lid down, there's what they call meibomian glands. And those are like little canals, and they're filled with oil. So then when you blink, what happens is they excrete the oil, and then they kind of wipe over the cornea to give it some type of lubrication to keep it wet and your eyes to be able to see clearly. Okay, so this is just something to be aware of that I have created a lot more of an interest in since now I've been relocated my private clinic in the Watermark facility, is that dry eye is important. It is important. And I was just put a little drops on it, you'll be fine. No, it's a big deal. And so I think very holistically. That's just my bias. I'm always towards, instead of giving you a Band-Aid, I try to help figure out what the long strategies are, changing diet, also looking at other modalities that can actually maybe open up those glands a little bit more, talk about a full blink as you're working on that. Why? Because you want to make sure you get as much of those excretions onto the cornea to give that eye the best opportunity for clarity. So that's one level. We have what they call ATL, which is applied thermal lid treatment. This is the best option that I have been able to find right now. Just so you know, you can always do the ointments, and I would say to look about putting more oil in your diet if you can, if it's isn't contraindicated with anything. But that's usually what I try to recommend, is to use this a warm treatment. It's kind of like, they love going in because it's a warm massage basically on your eye, and kind of wake them up a little bit afterwards. But we do that, and then we do what's called it's called photobiomodulation. It's different type of light frequencies that we work with to be able to decrease the inflammation. You decrease inflammation, it's not as swollen, right? And then the excretion of the oil can happen easier. So those are pieces that can be helpful. Is it a cure-all? I don't think it cures completely, but I think it also helps keep activated what's there. So in our process, we kind of break it down. One of the pieces that I do look at is balance. I watch to see, I have a lot of patients that come in that have a balance, dizzy, nausea, and they're like, and they're always a little confused of why they're coming in to see me. I was told to see you, but I don't understand. So we have to explain it a little bit more and explain that, again, you have sight, and then you have what I call vision. And sight is checking your central vision. But when we think about vision as a whole, as you look at me, you can see around the room, you can see to the right, to the left, up, down, you can visualize where you are in the space. And what we find is we know that there's more areas in the brain for vision than any other sensory modality combined. But very interesting, what's unique is that your peripheral vision actually has more different areas in the brain than your central vision. And we're finding that when we work with any kind of neurological insult, that if we work with the peripheral system, that we can actually get a lot further along and actually get the central system to be more engaged. And it can help with visual acuity as well, because as we engage that peripheral system, which deals with balance, we can be able to re-engage the visual system to have better stability. So then we look at what's going on with the visual system. And I do have some other brochures here about functional lenses. I'm very big about that because many times when we look at, as we go through life, it's okay, what's the cute pair? What's the ones that look the best, right? But you also want the functional ones, right? We have to think about that as when you're getting a prescription, and if you're having trouble with balance, one of the big pieces that we all want to remember is that the more prescriptions that you put in one lens, the more your system has to be able to integrate that information and move through it. So if I have one prescription in my lens, I have distance only. I use that one pair of prescriptions to understand I have a view of my space, and I can then learn to work in that view, right? If I have a bifocal, I now have two different perceptions of how I see space. One is for distance and one is for up close. Well, I'm not looking in the up close part. Okay, fine. Don't look at my hands. Don't be aware of my hands. Just look at my eyes. And oh, by the way, can you go down on the step, please? You only use your distance. Do you know how impossible that is? You have to, even if you are good at it, you have to suppress that information. So you have so much gas in the tank, okay? And you only have that much to work with the whole day. And if you're now told to, if you're having a conversation and there's a motorcycle revving up its engine and you're really trying to get in that conversation and listen, you have to suppress that sound while listening to somebody else, right? That requires energy, that requires attention. So that's extra effort that you have to constantly be doing all day long while you're trying to get this information that's so important to you. So sometimes I say, my patients love me and sometimes kind of get mad at me at the same time. All right, fine, then let's just do this. But the idea is that I want them to feel success. Let's feel success first and experience that and then start adding on. But if we don't have a baseline for success breeds success, right? We get those neurons to fire together that are wired together and keep getting stronger. That's our goal. And so the more that I put in there, the harder. That's the same as if we say, okay, let's do a progressive lens. Oh, we just ramped up the whole thing. How many lenses do you think are in a progressive lens? 5, 6. Because you have to gradually move, you have to progressively move from a distance prescription to a near prescription. Just imagine, where's the sweet spot? Oh, wait, oh, yeah, there it is. I got it. Okay, now move. What? Now you have to suppress that information and the other information. There's a lot going on there that we have to take in that we take for granted. So do I always only do single vision? No. But I will look to the function of the patient of where we need to go, or the person. What is your interest? What is your goal? Let me give you success. What do we need to work on? And also, quite frankly, I find that body posture changes accordingly to what they look at or do. If they're looking at distance, I may have a slight head tilt. When they're looking up close, I have more of a slight tilt with a head turn. What just happened? I may have different kinds of prisms. I may have different type of body posture that I have to now negotiate to be able to give, okay, brain, that's what you want. Let me give that functional prescription, and then let me get the body posture to be effective. So whoever OT, speech therapist, whoever's working with it, PT, can give them the what they need to in a stabilized environment. So then we're going to take it one more notch. Cataract surgery. Going in. Okay, I got the halo going on, and I'm at night when all the lights, things are coming in at me. I see the cars with the halo lights. Okay, I'm going to go get cataract surgery. Well, I'm going to get model vision. One eye distance, one eye close. What just happened? You compromise your binocularity. So I find that the more that we do model vision, the more that there is a difference between the distance eye and the near eye, the more chance there is for wrist to fall. How much does vision play into balance? All day. Attention. Hopefully it's becoming easier to find the connection. So attention, if you're working so hard at being able to hold that focus and getting your eyes to team together, making them work together, and you don't want to do it that much after a while because it's too much work, right? That's just even the kid that has ADD or trying to get their eyes to focus. We find three-fourths are the same diagnosis that we look at for visual dysfunction in children. Same thing happens as we get older. Same idea. The more you have to fight that system to team to create the binocularity and the ocular motor tracking to move and to integrate, the more difficult it is to hold your attention. Because you got to fight going this way. You may have to fight going this way, or you may have the full-on thing that I had with swimming. It kind of moves around. So I'm going to go this way, so I'm going to go this way. The more tired I am, the more it moves, the more stressed I am, the more it moves. Why? Because it's integrated with the brain. Same stuff, working with the brain. So the more I can get the system to work together, we find out the better attention that you have. That's also with accuracy, right? The more I can get my eyes to team together, the better I can be accurate about locating the image. Whether that's, a child crawling on the floor, learning the right and left movement, to be able to learn that cross-lateral integration, to be able to grab that Cheerio, right? That athlete that's trying to be able to hit that ball going 60 miles an hour, to even being able to know where to put your foot. It's all in the same space. And that's what's the beauty of it, is we keep integrating those spaces and all those things that you've learned from a child to a teenager to adult. We still got a lot of those places that we can play in. What did you like to do? What opens your heart? What makes you move? Let's start looking at those spaces and learning how to integrate what that accuracy is. So let me teach how your body moves through space and how you can be able to understand that space. I talk a lot about a lot of different disciplines in what I do because they all interlink in so many different ways to realize that, to me, honestly, it's a label. And they all kind of merge together and they all kind of integrate together. I work one day a week with autistic children. And it's beautiful because I can see when they're not in their body. It's like, okay, let's get in your body. And then let's work how to bring your peripheral system into create an awareness. And then your central system becomes engaged. So then I can create that ability of balance between your vision and your body, and then everything slows down to create a rhythm. But everything has a rhythm. And so we just have to find what is your visual story to figure out where your success is. What is your vision story? Where is your success? Where is the place of weakness that we need to kind of dive into? Where are the pockets that we can start building those spaces to integrate the highest level of integration? Because we have neuroplasticity. In our modalities, we do an assessment. We have different aids, may it be specialized lenses, different types of glasses. I'm very big into supplements. I ask you to ask either your physician or your naturopath or your nutritionist, whoever it is that you work with, to make sure that we're appropriate in what is recommended. And then I'm very multidisciplinary in the sense of what are you doing? What are you having trouble with? How can I help you? And then we work together to just decide on what modalities are effective, depending on what your goals are. And I try to make them as much as I can. Well, that's your goal. Can we do this goal first to get that goal? So we kind of try to work together as a team is always my approach. There's a lot of different ways that we do screenings. One that, we indicated that you saw before with the right eye, you can come in and just have the right eye done. And that's for all that, if any of the therapists or those that are in rehabilitation say, you know what, I just want a right eye. I do that with neurologists. I do it with sports medical docs. I do it with other types of assessments. They can have it done. You can have the information to know what it is. It's provided. I think it's important to understand. The more we can understand what it is that's going on, it empowers you either way. You're taking an unconscious behavior and making it conscious. You're taking that awareness of what's happening. There is some cognitive assessment that can be done as well. We do a balance assessment, and there can also be a health assessment for dry eye. Just as you saw the scan of the meibomian glands for dry eye, you can just have that assessment if you want. I'm very comprehensive in my assessments, so sometimes it may be just like, too overwhelming. What do you want? Just pick where your interest is, and then we can look into that as well. In a comprehensive evaluation, yes, it is a long one, and it can be broken down. It can be broken down into different days if we need to. I do that a lot with different cases, depending on how we can find the best ability of where you are. That's the goal, right? We don't have to do a long one. It can be very short, and then we can go in and do it again. There's no extra cost to that because my goal is to learn about you. So that's how we look at that. Body mapping this is a place that I also work in another rehab clinic that I go in once a month, and I'm a vision consultant. And the cases that are interested of me reviewing to see if vision is a part of it or not, I'll go in and look at their abilities, and I bring in what's called a VEP, visually evoked potential. I'll watch their body posture. I'll use my yoga prisms. I'll see if I can make a difference, and I'll do a before and after checking their brainwave patterning to see if I can make a difference. If I can, then a lot of times I'll say, yeah, I think we can make a difference here, or here's some modalities that I would recommend. So that's another level that we can work at. So in this space, I have just started doing this a little bit more and doing more vision consultations. We're adding that to the website in a sense. If you just want to talk to me for a little bit, I go in two different levels. One is just talk about what's going on. Hey, this is the case I have. This is what's going on. Do you think vision can be integrated? It's just a real short moment of yes, I do, or no, I think you should probably go this direction first. That's free. Okay. If I feel that we need to go a little bit more in depth, we can do. I'm working a lot more with people overseas, and so that's why some of this is virtual. We do a screening where we check ocular motility, we check accommodation, NPC, and then that information is brought to me with other information that's given either from their neurologist or the data that reports of that. And then I can go through that and say, yes, I do see some limitation here. This is some of the things I can work on, or I would require an exam first to do it a little further or try it now and see how far you get. And if you're still having difficulty, then then come in. So I'm really trying to amend in different modalities of what we can do. We're just putting this on the website now of the different levels that you can go on, and you can even schedule your own online. So that way, if you're interested, you can have that. And it does also go into how we determine it. Right now, I am a part of level 1. I may not always be, but I am right now. So level 2, yes, I'm on in the second stage of that. That is me always. And this shows you a little bit more on our website of the areas that we work on. Brain injury, we work a lot. I love working with children. I love working with the active aging. I work on athletic spaces from A to Z. And then we also work on the right eye screening and results. There is a lot of that runs through our practice, and we train a lot of other healthcare providers of how to screen, what to screen for, how to be able to do that assessment. So overall, we know that the vision and the body work together, dealing with proprioception. I did put a little bit on here to spice it up a little bit if you all are interested in integrating some of the visual component of it. I would recommend, if there's a lot of patients out there, I'd say just defer to your therapist for this information, and I can go through that with all of them on what they're doing. But really realizing that even in a movement, really understanding how your visual system is a part of doing that next step forward, and how to really take a pause and give yourself a moment to really feel where your body is. Understand, by opening up your periphery gives your brain more information to take in, to then process and hopefully stabilize a little bit more as you make your next step. So many times we move fast. And what I say is it's actually harder to move slower. So if you take the moment and just allow yourself to pause and let that information come in to bind what you see with how you feel, then you have a better chance to make that next step forward in a successful way. Another modality that we talk about, again, I can refer to your therapist to provide this, is more learning how to work with your periphery. As you look straight ahead, how are you aware of using that peripheral system? Can you be able to look at a central target, be aware of the periphery, and then move to that location? How well can you be able to get? Is it better on your right side or your left side? Just creating that awareness can be very informative. And truly breaking this down into even 4 sticky notes on a wall. Because if you can be aware of one, can you be aware of all the rest of them that are around? Whereas if you're not aware. So all of these pieces keep informing you as a patient of where is your strength? Where is your weakness? If you can be able to bring yourself a little bit more upright, are you able to see that space, that peripheral awareness at a larger extent? That can then give you your understanding of space to be able to keep your body upright. Another technique works in a saccadic movement as well. I think the biggest piece here is that it's connecting. It's connecting with other rehabilitation techniques that you're already doing, but I'm now putting in the seed how much vision plays into all of them. So I am, you're very welcome. Anyone is welcome to come and visit the practice. Anyone is welcome to come. We can learn and set up workshops. We can set up training facilities. I'm opening to look at different levels of consultation, whether it be free and just learning about what it is and if this person could be a candidate or not, or even kind of diving in a little bit deeper into doing a full assessment. That is available as well. I think it's coming together and working as one, and learning that we can have hope, and realizing that we all have a different visual story. And the one that we're in, is it as stable as it can be, or could it be improved? Thank you for your time. Sure, sure. Questions, anyone? Yes.
So do you recommend everyone with Parkinson's get an evaluation? Number one, and number two, do you take Medicare?
Oh, I wish I did. I did for a very short time, but it didn't work. Would I take everyone involved with Parkinson's? Oh, that's a large question. I usually don't make that broad generalization, but I do believe that the visual component is a huge piece of any level of Parkinson's. I guess it depends on the interest of the patient, and where their goals are, where their symptoms lie. You know, I conservatively would want to learn more of each case, honestly. That's where I'd start, to see if I was a match for them, if it seemed to be where they're looking at going. You know, that would what I want to learn first.
Can you repeat the questions that they asked? That
Oh, I
people on
apologize.
Zoom?
Yes, please bear with me virtually. The question was, do I take Medicare? And unfortunately, that is no. I tried, and I couldn't figure it out. I've always been private pay, and it affected me greatly. The second question was, would I be interested of working with anyone with Parkinson's? And of course, I would love to work with everyone, but I think realistically, it would be better to get to know the patient, the client, and the case of where the goals were, where the interests lie, and where I feel I could make a difference. Yes.
Are any general exercise?
So the question was there any general techniques or exercises that could be done? And yes, there are. There are some general exercises and techniques that I could recommend. It will take more time than I could do right now, but most definitely, if there's ever interest within this organization or another way to respectfully for everyone, yes, there are specific things to start working on. And that's honestly what I'm exploring now, is to empower the person and to give some basic skills and general techniques that can be started and learned. But yes, I believe so.
Would you, I'm online. Would you take an online question?
They're asking, we told them to put it in the chat if they have an online question.
If you have an online question, could you please put it in the chat so we could read it?
I did put it in, but it's you're not answering them.
Okay, let's see here. Okay, so one of them is asking, does online computerized vision exercise programs help with double vision insufficiency? My neuro-ophthalmologist prescribed CVS2 program. And it was, I guess, I tried the activity using prism glasses. You know, I don't know the program, so I can't say if it would be effective or not. And with the prism glasses, I think if your prism glasses are working for you for the distance of where the computer program is being given, then there's more of a chance. If there's anything with a bifocal or a progressive lens in that, I think it would create more instability for your eyes to team that could cause some frustration. I would like to say things could be that easy, but I am more into more free space techniques to begin with for someone versus a computer program. That's just my bias. Can you share some diet advice for dry eye? So I always have to be careful about this because there's always something that's contraindicated with medicine. And with that in mind, if there isn't a indication and your PCP or primary care or the person that you work with, it is okay with them. I am into using different types of oils. I think oil is important in your diet. I think that's important in using, and I'm all into the krill oil and the cod liver oil, but you have to be very careful on, and I'm a little more of a purist in that sense of looking at different brands because a lot of them are not good. So I would look at that area first to see of using that. Also, when you're working with dry eye, I don't know if you guys have done this before, but using a warm compress, that can be really effective. Or you can buy those and put them over your eyes and then work on a hard blink, like a real solid blink, and then open and then really do a strong blink. If you're ever on the computer, that can actually decrease your blink rate. So that's something to be aware of. If you're looking at the computer, always to kind of look away every about 30 minutes so that you actually blink more often. So any kind of oil, even coconut oil, extra virgin oils, all of those, that's where I tend to go. If your skin is dry, then usually that's another indication of the rest of your body being dry, right? Let's see, are there other specialists like you available in a listing or website? I live on the opposite side of the country. Oh, I lost that. Just starting to try to get some supportive team together. Of course, yes. So I am very biased towards NORA, which is where I'm on the board at. So Neuro-Optometric Rehabilitation Association. If you look that up, nora.org, and you put in your zip code, I'm hoping that something can come up for you on that. And so that's where I would look, because they'll be a lot more integrated into visual body integration as opposed to just vision. And I think that's the piece that we tend to lose, is that just eye exercises can be somewhat helpful, but really looking at overall function is really, I believe, an eye brain body technique. Keeping your body organized with vision exercises is usually more of an impact. Do you have any good exercise program before using prism glasses? It depends on, I would love to make that simple. The question is, what kind of prism glasses if you're talking about the Yoke prism glasses that I use in my program, yes, you can. Basic techniques of things just to begin to work on, I would say in a very general way, is to just make sure that you have full range of motion and to work with that. If you had a ball or something, you can work with it, just being able to see of moving the ball down, up, and then back and forth, just to see if you can be able to organize that and going up and moving with that, because your proprioceptive system can be able to align with your tracking ability. Prism glasses in general, if you have a vertical or horizontal double vision, then that's something different to look at. It's I'm not prepared enough to be able to give specific techniques right now, so I apologize for that because that's the first thing that comes to mind right now. But when you work with if you work with a ball, you can work with a smaller one, or you can have something just in even one hand if you need to start there. And the idea is just to really be able to use your body information to teach your visual information of how to move. A lot of times when we find that there's any kind of neural insult, we tend to forget to learn how to use our eyes and to move our eyes left and right individually or independently from our body. And so if we can start to learn that a little bit more, even by either laying down and start trying to see if you can move your eyes from one side to the other, to moving it up, moving your eyes downward with your hand, or having somebody else, you lay down and having somebody else move, and you can either use a little bit larger target, maybe something that's lit up because that stimulates the brain to hold focus, and start learning of how to track. Because a lot of times I find that people will think that they're looking at the image when really they're not. They're using their peripheral system. You can see my hands while you're talking to me and not really look at them with your central vision. So that can be lost in that space of when am I using my central vision and when am I using my side vision? And so if we can start creating that awareness, that would be a good place to begin. And that's why a lot of times we can use a computer to start off and keeping still, I guess, and learn and moving your eyes. But I love real space and time. I think that is the first place to begin. All right, it's silent in both worlds. Well, I appreciate your time. I love what I do and I love sharing with others. And so thank you for listening. Thank you for spending this positive moment in your life with my life.
I do have a
I wish you the
question.
best in your journey, and I am here if you need anything. Thank you.
Yeah, thank you, Dr. Powell.